Callie. My name is Allison. Nice to meet you.
It's nice to meet you as well, Allison.
I'm going to be your speech language pathologist today. First, I want to thank you for coming in today. Did you get here okay?
It wasn't too bad, mostly because I live pretty close to here.
Okay, good to hear. So what brings you in today?
So I have a first grade son named Ben who has been struggling academically.
Okay, so would you say his struggling academically relates more towards his understanding or articulation or something else?
His understanding at home and in school mainly, he struggles with understanding. It seems like he isn't listening.
Okay, so would you say his speech is pretty good then?
Yes, it's more of his listening skills.
Sure. So have you seen any other speech language pathologists before in the past?
No, we haven't. This is a first for us.
Oh, well, welcome. So when would you say you first started noticing the problem with him?
I'd say right when he started preschool, his teachers began to notice he wasn't doing what was being asked of him. We thought his mind was just all over the place at home.
Sure. So do you feel there are times during conversations where he gets pretty frustrated if he doesn't understand what's going on, and how do you handle that?
We find ourselves having to repeat things constantly, but we don't get frustrated. At times he gets a small temper.
Okay. Well, it's definitely good to be calm in situations like that where he may get frustrated. Are there any other developmental issues that you have noticed?
No, none that my husband and I have seen.
Okay. How would you say he interacts with others, like maybe other children? Is he more aggressive, or is he cooperative, or things like that?
He's friendly and cooperative with his classmates, just gets frustrated more at teachers and us.
Okay. So has this changed since you first noticed that he wasn't fully listening?
It's gotten a little worse over the years, but for the past few months, nothing has changed really.
Sure. So how would you describe the way he usually communicates with you guys? Does he use short phrases, full sentences, or just a couple words?
He's able to communicate using sentences normal for his age, but he answers and replies incorrectly.
Okay, I see. What language does he normally speak?
My husband, Ben, and myself speak English at home and in public settings.
Okay. So next I have a few questions to ask you regarding to some of his medical history, if that's all right with you.
Yes, perfectly fine with me.
Perfect. So were there any complications during your pregnancy?
Nope, everything went smoothly except for Ben being born a week and a half past his due date.
Oh my, he wanted to wait in there till the last minute possible.
Yes, I wasn't too thrilled about that.
I can imagine. So what was his birth weight when he was born?
He was 8.5 pounds, which is pretty normal according to the doctors.
Yeah, boys tend to weigh more way more than girls do normally. Has he suffered from any other illnesses or conditions like a cold, fever, stuff like that?
He did have an unusual buildup of wax when he was about 2, I believe. We gave him ear drops for that, but otherwise he had a few colds as a child, but that was it.
Sure. So have you had any recent issues with wax buildup again?
No, not recently or since we noticed it the first time.
Okay, that's good to hear. So in regards to school, do you know if the school has developed an IEP or an individualized education plan for him?
School is right around the corner, so if things don't get better, I'm hoping the school will assess him and design a plan of action from there.
Yep, it's that time of year. Summer always flies by pretty fast.
Yes, sadly it does.
I can agree. So what would you say your goals are for him academically?
I'm hoping and wanting him to be able to follow, listen, and correctly understand simple directions and what is being said to him. This hopefully will help him understand more of what is going on and respond correctly.
Yes, and I'd say that's a pretty good start, and that's something that we can for sure work with. And after completing some hearing assessments and procedures, I should be able to assess more what's going on and lead you in the right direction.
Perfect. I'm looking forward to taking this next step.
Perfect, and so am I. Do you have any final questions, concerns, or comments for me?
Not at the moment, I don't.
Okay, sounds good. So thank you again for stopping in today. I'm looking forward to working with you guys in the near future. Woohoo!
I should have wore my glasses.
I'm sweating bullets.
I should have worn my glasses.
Look.